Oh my gosh. Hey everybody, how are y'all? We'll be getting started in a minute. Hey Trees. We'll be getting started in a minute. If y'all hear my dog bark, please forgive me. I'm about to grab her right now. Let me get this together. I'll be right back. Okay, so we're gonna have y'all know we always have fun on my lives, but this one I know a lot of y'all have questions about what we're going to talk about tonight, and I'm actually rather excited because anytime I can truly go all in on something the way I do, but help a lot of people, I'm always with that. Okay, so today the title of this was Vaginitis, Trichomonas, and the Secret Infection. So, y'all hearing through vaginitis a lot, even though y'all still don't be paying attention and y'all don't be listening to what I'm saying. But we're going to talk about, the first thing we're going to talk about tonight is Trichomonas, Trichomoniasis, however you want to say it. Trick is going to be the first thing we talk about because it is so tricky. It has the right name. It is so tricky, especially when it comes to men. I really do hope some guys are tuning into this. Because trick sucks, and so many men actually convince you that you're crazy when trick comes up, and let's talk about why. So trichomoniasis, trichomonas, whatever you want to call it. Most people just call it trick for short, right? And request to be, I don't understand, y'all. I'm not that great at Instagram, so y'all be requesting to be in videos and stuff. I don't know what all that means, so don't think I'm rude. I'm just rocking with the live. So anywho, trick is, I don't care what people tell you. I don't care what crazy, obscure article you find to feed into your own insecurity. And I said that. Yes, I said it. But trick is sexually transmitted. There is no comma. There is no semicolon. It's a period. It is sexually transmitted. Okay? Now, let's talk a little bit more about it, because trick is really, really interesting in that, if you got gonorrhea, you got chlamydia, you're going to know it. Okay? But trick is a little different. Okay? Because trick really does mimic. It looks a lot like vaginitis, but it is definitely not vaginitis. People say, well, it smells the same. It all smells fishy. No, I can tell the difference, and hopefully some other gynecologists too, I'm sure. But there's a difference in the smell with trick. But nevertheless, it's a fishy smell. Trick is always very, very a fishy smell, foul odor. Okay? Trick is really interesting because it can stay around for a long time. Now, we haven't started talking about the male component of it yet, y'all, because that's a whole situation. Okay, so let's just talk about the female component. Trick can kind of hang around for a little bit, not like years without you knowing, but it can hang around for some months without you knowing. And a lot of times you won't, the only thing you'll really kind of see with trick is odor. But you could also see like abnormal spotting. Like I had my period was finished, and then 2 days after that I bled again, and you can see that with trick. Okay. Also, trick can, after it kind of lingers around for a little bit, cause a little bit of discomfort. And you're just like, I don't know what's going on. It just feels uncomfortable. Trick can cause a little discomfort. But if you don't have any discomfort, don't be like, oh, I must not stop it. Don't be like, oh, I must not have trick because I'm not uncomfortable. No, trick, it varies. And again, it's usually very, very subtle. Okay. A lot of times, a lot of doctors, unfortunately, are so lazy. So what they do is they'll put it under the microscope, and they're like, I don't see anything. Because interestingly enough, under the microscope, trick moves. But the issue or the interesting thing, if the trick is old, then it won't move anymore. So a lot of doctors are just looking for the movement. And if they don't see the movement, then they say, oh, she doesn't have trick. That's not the case. Okay, that's why no matter what, I send everything off to the lab. You come to me, oh, I think I got a yeast infection. Oh, you might, but we're going to send it to the lab because what we're not going to do is miss something. Okay, so I'm big on making sure that I just get tests on everything. But Trick is just that thing. It is sexually transmitted. No, you did not get it from a toilet seat. No, you did not get it from wearing your girlfriend's, your daughter's, your homie's thong. You did not. I'm sorry. You just didn't. You got it from whoever you're having sex with. You just did. Period. Okay. Now, let's talk about the male component of Trick. Okay. The male component of Trick is really, it sucks. It sucks. It sucks for us women. It sucks. Okay. So why does it suck? Because when I bring my patients into the office and I say, hey, you have Trichomonas, basically I, explain Trichomonas to them just like I just explained it to y'all. And then I tell them, so now you have to talk to your partner. Okay. Here's the gag with Trick. If you notice for a male, everything comes through their one hole. That's urine, that's pus. Well, let me back that up. That's urine, that's semen. And people say, well, why you say pus? Well, semen is urine and blood and pus and sperm. That's what semen is. Okay. So bear that in mind the next time y'all swallow, because y'all, a Meg the Stallion freak. And then you don't know nothing about your partner. So bear that in mind. But either way, so everything comes from, one tract in a male. It's just all one tract. And so what tends to happen is the concentration, not the actual Trick itself, is there. But the concentration seems to go lower and lower. And so what happens is once they go to get tested, because you tell them you gave me Trick, once they go to get tested, oftentimes, and I hate to say it, but 9 times out of 10, their tests will come back negative. Sucks, but it's true. So their tests will come back negative. So now you got a situation where you have an STD, your partner, who in your mind is your only partner, and now you're telling them I have an STD, and now they're telling you my test came back negative. And now you busting your brain because you like, where did this come from? Where did this come from? What is happening? And it's true. It can come back negative. Doesn't mean he doesn't have it. No, it just means that the concentration that's actually in, because they checked their urine, the concentration that's actually in his urine is low enough that the test will test negative and it will reflex negative. Does it mean that they don't have it? Hell no. And that's why I always tell my patients, tell your partner that you tested positive for it and they need to be treated. Not even they need to be tested. They need to be treated, because real talk, whether they come back positive or not, if y'all had sex and you got it, they got it. I don't care where it came from. That ain't my business. That ain't my place. That ain't my ministry. I don't care who gave what to whom. I'm going to treat you because you're my patient and you go somewhere to get him treated. Okay? So, chill. So, that is the gag or the judge when it comes to Trichomonas. So I know some of y'all are on here. Of course, y'all not gonna be like, oh my God, that happened to me, because nobody wants to admit that they had Trick. It is what it is. We all make mistakes. We all, end up in situations. It is what it is. But the point is, no, you are not crazy. Yes, he gave it to you. You're like, I know he was the only one I was having sex with, and I ended up with this Trick, and then he was negative, and he showed me his test results. That's how. Okay? That's why, again, I find it terribly important that before you start having sex with somebody, you stop it. You have got to, I didn't say it started with males, never said that. You have got to make sure you see their STD testing. Before you lay down with anybody, it needs to be like, so when's the last time you've been tested? Oh, okay. You got some paperwork? Y'all are so scared. Y'all are so scared to ask for questions, to ask information. Like y'all situation is that fragile. Like if somebody who, I'm going to need you to check. Did you just say what is Trick after I just read? Oh, girl. So, the thing is that at the end of the day, please don't let your relationship or your situation be so fragile that you refuse to ask any questions that can protect you. Like, come on. Really? Like, you can't be like, so when you got tested last? Oh, okay. All right. You got some paperwork? You been okay, because I got some paperwork. Okay. So that's a big thing for me. So y'all, please know and understand that it is very important that y'all see their testing before. Yes, trick is sexually transmitted, and that's on period. Okay, that is on period. It is sexually transmitted. Don't let anybody convince you otherwise. I don't care who done found some weird, strange article that said, no, it is sexually transmitted. Unfortunately for a male, no, they don't have any symptoms. Again, they can have it for a long time. And a lot of times, I'm not a hater. Like, I'm not a hater on people, period. And especially being a gynecologist, because how you put things across, real talk, it can really impact the way people think. And I'm very careful with that. Like, I'm very clear that Trichomonas can be present for a long time in males because they don't have any symptoms. Now, that doesn't mean that you can be, okay, so what I'm saying is, let's say you just get with somebody and y'all just have sex, okay? And he gives you trick. And he's like, I ain't been with nobody in a minute. He might not be lying. Like, it can hang around for a while. It can definitely hang around for a while before it presents as anything. It can hang around for a while before, you know, whatever. He hadn't had sex with anybody, or he hadn't had sex with you. And he's like, I haven't had sex in a while. You know, how can I have this? It's true, because males don't have any symptoms. But if this is your man, and you've been to the gynecologist in the last 3 months, and all of a sudden you pop up with trick, and you haven't slept with anybody else, it ain't old. I'm sorry. Math is math. Okay? So that's a big thing when it comes to Trichomonas. What I love to just get across to everybody is, unfortunately, males don't have any signs or symptoms. Unfortunately, they can test negative even if they actually have it. So it really does suck. But just know and understand, if you know you're not sleeping with anybody else, and you come up with trick, it is sexually transmitted, and that's on period. Don't let nobody convince you otherwise. Like I said, if y'all just, you know, got together, you haven't been in a relationship with him that long, blah, 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 whatever the case may be, I tell people very clearly. They say, well, yeah, you know, we did just get together about 3 or 4 months ago. Okay, here's the deal. He could have had it when he met you. So you get treated, he get treated, and then after that, nobody should be able to give anybody anything. So if he gets treated and you get treated and everybody's negative, if you come back positive again, his story ain't right, sis. And that's on period. So, you know, I'm very clear, you know, about how trick works with my patients. And I think a lot of times it's missed. And, you know, you get some guys who really aren't doing anything, and, you know, they get dragged. But y'all, we got a whole component of women out there, y'all, in some special kind of denial zone. And I don't know. I just don't know. So that is trick. Okay. Now, I want to talk about the hidden infection, the secret infection, the infection that nobody talks about. I love this. It's not that I love the infection. I love to diagnose the infection, because so many times, so many people have chronic problems behind this infection. Can you please? So many people have chronic problems behind this infection that's never looked for, that's never discussed, that's never found. And let's get into it. Okay, so as you know, vaginitis is an infection of the vagina, right? Like vaginitis, it's inflammation, it's infection of the vagina. Okay, but there is another infection that, and I hate to keep saying I love it, but I do, because it's such an easy find if you're just looking for it. And it fixes so many things if you just treat it. So let's get into it. Okay, I hope y'all got a pen, a pencil, whoever your gynecologist is. You need to be like, so let me ask you this. And if they're not answering these questions, they act like they don't know, you can drag them. Like, I love for y'all to be educated consumers. I really, really do. I really do. Okay, so I'm so excited about telling y'all this, okay? So this is one of my secret sauces. So, okay, the cervix, as you know, is at the bottom of the uterus. So you got the uterus, and then you got the cervix, okay, which is at the top of the vagina. So you got uterus, cervix, and then vagina, right? Okay, y'all still with me? Okay, so at the top of the vagina, like the back of the vagina, way back, you be like, oh, he hit my guts. Yeah, that's the cervix. Relax. So the cervix is a really interesting place. okay? Because the cervix gets infected too, okay? Now, let's get into this. If this dog will let me be great, oh my gosh. Zoe is killing me. Please, you're not going outside. So, the cervix. Remember I told y'all that semen is more than just sperm. It is sperm, it's urine, it's blood, it's pus. Remember I told y'all that? Okay. Well, the only thing the body actually uses from semen is the sperm. It's all it uses. So imagine the cervix as like a sponge. Imagine that. Now, the cervix collects all that, the blood, the urine, the pus of semen, but it collects the semen. And your body just really kind of like reabsorbs it, meaning it eats it up. Your body just like eats it up and disposes of it. Okay? So, with that being said, after a while, think about this sponge, and after having multiple episodes of unprotected sex, imagine the cervix getting engorged, meaning it's like when I said think of it like a sponge, think of it like a sponge you got to wrench out. As your grandmama would say. They say down south, wrench it. So think about your grandmama having to wrench out that sponge, okay? So if you do not wrench that sponge out, which most people don't, because most doctors don't talk about it because it is ignored. But if you don't, it will start to give a little bit of discomfort. I think that it makes your periods real different. And I also think that it gives you, stop it. It gives you an odor. Now, your discharge, and I'm sure some of you are like, because all y'all know is vaginitis and yeast. That's all people know. And that's all doctors talk to you about. But it goes further than that. So a lot of times your odor doesn't really fit in any one of those categories, and then y'all are confused. So how many people have had odors that smelled like musty? Like no matter what, you just feel like you just can't get fresh. Like some people say it smells like cat urine. Some people just say it smells musty. Some people just say it just smells like I'm just sweaty. That type of thing. Well, that is when your cervix is infected. Okay. And this is not in any text, not that. That's in the textbook, but it's actually called ureaplasma. Y'all ready? Is ureaplasma. For y'all Googlers, I don't want y'all to spell it wrong and then y'all like, that's urine. No, it's ureaplasma. That is the infection that lives in the cervix. Now, let me be very clear. It is not sexually transmitted. It is sexually associated. What does that mean? It means it's not a disease. It's just not. It's not a disease. It's not really an infection. It just is. But don't be like, oh, you gave me ureaplasma. No, it doesn't work like that. Like it just doesn't. That is the bug infection or whatever that we treat when we're dealing with the cervical infection, or at least that I treat when I'm dealing with the cervical infection. I can't speak for any other provider. So what I've noticed is, and let me be very clear, that I feel like, your hip bone's connected to your knee bone, your knee bone's connected to your thigh bone. I feel like if you don't treat all of the areas of infection, one is just going to reinfect the other. Does that make sense? So for me, what I like to tell people is, sometimes I can smell both. It's really funny. Like literally when you come in and examine, I smell the little Q-tip. I know exactly what infections you have. How many of them? I know exactly what you have. So oftentimes, I will tell people, hey, you have a cervical infection. We need to treat both, or it's just going to keep popping back. Okay. And what does that mean? So, let's kind of get to vaginitis as we're ending with the cervicitis, but, it's not sexually transmitted. Again, it's sexually associated. And really, I treat it with 2 pills, 2 pills one time, swallow them both down. You're done. Okay. Now, the thing that sometimes makes me gag is because I'm very straightforward. So as you can see in my IG lives, I'm very straightforward. If I think you got an STD, I'm going to tell you. Like, I didn't give it to you. I really don't have a dog in that fight. I'm going to tell you. But if I think you have ureaplasma, I'm going to tell you that. Okay. I'm in Atlanta. I'm in Georgia. If I think you have ureaplasma, I'm going to tell you, and then I'm going to treat it. Okay. The treatment for ureaplasma, incidentally, is the same as the treatment for chlamydia. I'm not saying it's the same as chlamydia. I'm just saying it's the same treatment. So don't let a pharmacist convince you that I'm treating you for chlamydia. I would have told you if I thought you had chlamydia. Yes, ureaplasma. Somebody spelled it right. Absolutely. I would have told you that I thought you had chlamydia, but I don't. I think you have ureaplasma. That's what I'm treating. Take it however you want to take it. Go with it wherever you want to go with it. But oftentimes when I see people who have recurrent vaginitis, oftentimes it's because they actually have a cervicitis in addition to that is being ignored and not being treated. Okay? So that's that. Okay, so we got Trichomonas, right, y'all? Y'all got it. Y'all not gonna let these jokers convince you it's not sexually transmitted, blah, blah, blah. But in their defense, they don't have any symptoms. It can last for a minute. But if you've been with your man for a minute and all of a sudden you pop up with it, that ain't new. I mean, that ain't old. That because you would have had it. But if you just started having sex with him and all of a sudden now you got it and he's like, nah, I wasn't messing with nobody for a minute, he might be telling the truth. Okay? So you got to kind of take it in its context. If it's a new relationship, don't be like, this joker got some dirty D. Well, if you don't have a cervix, it's not infected. It's vaginal stuff. And we're going to get to that in a minute. Don't be like, oh no, he got dirty D, blah, blah, blah. No, that's not necessarily the case. Don't ruin a perfectly good relationship over something that somebody didn't know that they had. Okay. So you get treated, give them the chance to get treated. And then if he's still, you really acting up for these people, I just have a seat. And then if he's still, you come back and you still got a little something. Okay, so we got the trick. We got the cervicitis. Yes, you have to have a cervix in order to have the infection of the cervix. It is not sexually transmitted, but it is sexually associated. Yes, it is easy to treat once you're actually looking for it. And sadly enough, like I said, I know it when I see it, but it is very, very difficult to find a lab that will actually separate out and test for ureaplasma. And oftentimes, because sometimes the providers don't know how to code for it or whatever the case may be, but then oftentimes what will end up happening is the patient might catch a bill for it, and then y'all be raising hell with these bills. And so, we do what we can without y'all raising hell. But, so I can promise you, even in my office, I don't necessarily test specifically for it anymore because unfortunately the insurance companies weren't covering for it. Y'all were getting bills. Y'all were yelling at me, and I don't like to be yelled at. I want y'all to be fixed. But what you not going to do, okay, what you not going to do with West Philly, Tasha, is get to yelling and screaming over some $50 or $60 bill. We're not going to do that. So after I done fixed the problem that you done had for 13 years. So we're not going to do that. So now, it's just a matter of I don't even send to the lab. I know it when I see it. I just treat it and keep it moving. Okay. Is there any harm if you take the treatment and do not have the infection? No, it's just like any other antibiotic. If you take an antibiotic, you may end up with a yeast infection. Obviously you can't constantly do it because you'll become resistant to the antibiotic. But to take the 2 pills one time, it's not a big deal. It's not a big deal. Okay. So yes, it's better to go ahead on and treat it versus not. Okay. Now, vaginitis. I'm going to tell you, I could talk about vaginitis for 2 straight years. I really could. And people still wouldn't have all the information because it's so complex and everybody wants to know specific. Zoe, why you always, please. And, you want to be on TV? Come on. All right. So, people always want it specific to their specific situation. And I'm going to give you what I give my office. Okay. And the interesting thing about us, I call myself the Vaginitis Slayer, and that's on period. I do. I am not arrogant. I'm not conceited, but I know what I know, and that's on period. So when it comes to vaginitis, get a pen, please get a pen. You got 2 seconds to get a pen. Let me gather this dog to pieces. I don't even really know what to do, but you got 2 seconds to get a pen. Okay. I'm going to run off for 2 seconds, y'all, and I'll be right back. Y'all get a pen because I'm going to need y'all to get this information down, because if y'all ask me at the end the question I asked at the beginning, I get a pen. I'll be right back. I'm not playing with you. Now you're going to forget to see this. Okay. All right. So, vaginitis. Don't speak to Zoe. Zoe's terrible. So, vaginitis. Now, there are a bunch of different arms to vaginitis. Okay? So, I break it up in a bunch of different ways. Okay? The biggest thing and the most common reason for persistent vaginitis is failure of treatment. Okay? Failure of treatment. And that is, most doctors use that dreadful, disgusting, got me out of breath, I done ran upstairs all fast, that dreadful, disgusting metronidazole and metrogel. Blech. Now, 40% of the time, it does not work. You say, why 40% of the time? There are 6 different organisms that caused vaginitis. 6 different organisms that cause it. Okay? Metronidazole and metrogel, both together, only kill 4. Okay? So if you have one of those other 2 types of infections, which are all vaginitis, they're just different causes. If you have one of the other 2, you can take it every day for the rest of your life and you still gonna have vaginitis. And again, due to cost, and because like I said, this is what I do. So my office actually separates and we test and we decide which type of vaginitis you have. But due to cost, a lot of doctors' offices that just don't. They'll look for Gardnerella. If you don't have Gardnerella, then they'll say you're negative. But what about the 5 other types? So I don't use metronidazole or metrogel. I use another antibiotic that treats all 6. Okay? So failure of treatment is one of the biggest things when it comes to vaginitis. Okay? The next thing when it comes to vaginitis is hygiene. Now, you would think you're not doing enough. That's where y'all be getting all jacked up. Y'all doing too much. Y'all know I examined some lady, some young lady the other day. She must have been about maybe 28, 29. Either way, I don't remember. She was in her late 20s. She had the outside vagina of like a 50-year-old. And she's like, yeah, I don't get wet. And I'm like, yeah. You know, I told her my whole reasoning for women not getting wet and blah, 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 her age and blah, blah, blah. And then I looked and I was like, oh my. And so we went through her whole routine. This girl's putting caps full of apple cider vinegar. I got people who put bleach. I got people who have put pneumonia. Ammonia, not pneumonia. Ammonia, regular vinegar, apple cider vinegar. And the worst offender is Epsom salt. I want you all to put a cucumber inside of all of those things. Leave it for 24 hours and come back and see if it's shriveled up. I would literally bet a whole year's salary it's going to be shriveled up or pretty close to. Why are y'all in these streets pickling y'all's vaginas? Stop it. And then you like, well, why won't I get wet? Baby, you have fried those glands down it. Like they are sauteed, like they are marinating right now, just marinate in salt. Like, what are you doing? So hygiene is a big thing. Y'all are doing too much. What I tell my patients, never shampoo your hair in the shower. Never. Your vagina does not like lauryl sulfate. I hate it for you. It just doesn't. It's just like taking a shower in Palmolive, Tide, and anything else. Just don't do it. Never shampoo your hair in the shower. Back in the day, what did your grandma used to do? Lay you on the counter and wash your hair in the sink. What did she used to do? Bend over and wash your hair in the sink. You too damn lazy. So what do? Wash your hair in the shower. Don't do it. It is not a friend to your vagina, okay? The next thing, never, ever, ever use any liquid soap. I know I'm going to make an enemy out of some of y'all, but if you want to get rid of your vaginitis, you will take heed, okay? I don't care who made it. Now, I'm going to be very clear. I am never, ever going to get on this platform or any other platform and drag any particular person, especially a Black-owned business, a Black woman-owned business. I'm never going to drag anybody, but I'm going to be very clear, okay? Never use liquid soap on your entire body, your body or your vagina, all inclusive. Never, 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 okay? And never, period. No bubble bath, no body wash, no perfume soap, no deodorant soap. I'm saying it. No Summer's Eve, no Refresh, no Vagisil, none of, or no baby wipes. Yes. Here, let me say, you want to wipe your booty with some baby wipes after you done, cool. But your vagina, never, ever, ever. And I get this question a lot about Dial. Dial is antibacterial for your hands, not for your vagina. It's not. What I tell my patients, and I swear some of y'all need to send this to Dove because I'm going to need a check soon. But what I tell my patients is Dove white bar soap only. Okay? Not the sensitive skin. I don't like that one. Not the exfoliating. I don't like that one. Just simple Dove white bar soap. Y'all are making this bathing thing like real extra. Like at the end of the day, it's a shower. You get in, you clean yourself, you get out. Why do y'all need all these fireworks and festivities? Like, I don't understand. Y'all are doing too much. Okay. I don't care what it is. I don't care. Like I said, I don't care who made the body wash, the bubble bath, whatever. You cannot use it. I'm sorry. I don't care who made it. You cannot use it. Now, take it for what it's worth. You can do what you want. It is your vagina, not mine. But take it for what it's worth. And that's it. Dove White is the unscented, my dear. Now, we have the hygiene out of the way. Okay? Then we have the treatment or failure thereof out of the way. The next big component when it comes to vaginitis is sex. Okay? Now, stay with me. Okay? I said a million times over that vaginitis, BV, vaginosis, whatever you want to call it, is not sexually transmitted. It is not. Okay? But it is sexually associated yet again. Now, I hate to say it, but it's one of those damn if you do, damn if you don't things. I think sex is healthy. I swear I think that people should have sex front, left, right, center. You have to be safe about what you do, but I think sex is extremely healthy. But again, you have to be safe. Now, y'all ready? Don't put your pens down yet. This sounds crazy. I tell my patients, do not use lubricated condoms. I'm going to say it again. Do not use lubricated condoms. And I really appreciate the people in the comments who are doubling back on the people who are asking me questions after I talk 10 minutes about something. You saying so I can't use it? I really appreciate the people who got my back and she's saying, no, don't use that. No, I appreciate y'all. Y'all are helping me out. I appreciate it. So I tell my patients to use non-lubricated condoms. Oftentimes you're not going to find those at your Targets and your Walmarts. Unfortunately, you really kind of got to go to Amazon and order it for yourself. And the reason is this. The lubricant that is on a condom 9 times out of 10 is going to be nonoxynol 9 or some derivative of nonoxynol 9. I don't like nonoxynol 9 to start with, and I'll tell you why. But it in and of itself definitely causes vaginitis. Okay? And outside of that, gang, the one thing that's really important is that nonoxynol 9, let's say your condom breaks, right? Do you realize that nonoxynol 9 in the mix makes it easier for you to actually contract HIV? Yes. And nobody says that. I don't know why nobody says that, but nobody says that. So I guess they figure you won't use condoms at all, which we don't want. We want you to use them, but I'm not a fan of lubricated condoms. Okay. I prefer to use your own lubricant if you need it. If you don't need it, then hey, listen, it is what it is. Now that that's done, let's talk about sex and vaginitis. Okay. Now, I'm going to tell you how to know if your vaginitis comes from sex, and I'm going to tell you why it comes from sex. Okay. Now, people tend to think, I knew he was dirty. I knew he this. I knew he that. It really doesn't have anything per se to do with his outside dirtiness. But it might have a lot to do with his inside dirtiness. I'm a save it, girl. It might have a lot to do with his inside dirtiness. What does that mean? Your vaginitis is really going to come from your partner having a poor diet, not drinking water, not eating green vegetables, sipping on the lean, popping pills. If he has a medical problem, if he's on, some type of medication, if your boo is, even if he's a gym rat, they're not immune either because they always pop these little vitamin packs from the GNC. They don't know what the hell that stuff is. They just popping it or the vitamin shop because they think it's healthy for them. They don't really know what it is. But basically what I'm saying is that his lifestyle, what he puts into his body is directly related to what's in his semen. If his balance is off, if he's not doing what he's supposed to do, then he ejaculates directly into you. That's going to throw you off. So people come on, I got this recurrent. Y'all doing this and I'm tired of coming back and y'all just want our money and it ain't going away. But the problem is that the actual offending agent you don't want to address. You don't want to admit. You don't want to fix. You want to be thirsty and be in denial and let anybody do anything to you and come all in your raw with all this foolishness, and then you want to come and yell at people like me and other providers. That ain't right. But anyway, we be knowing, but we just don't be wanting to hurt nobody's feelings. But if you've been in my practice long enough, you know I don't mind hurting your feelings when it comes to the truth. So anywho, how do you know? You say, well, how do I know? Like, how do I know where my vaginitis comes from? Here's a little bit of a telltale sign. This is not like 100%, but here's a little bit of a telltale sign. Like, you say, I was fine, I have no problems, and then I had sex with this dude. And then soon as after we had sex, like, I just smelled bad. And then it lasted for like a couple of days, and then it kind of died down a little bit. Well, one, it didn't go away, but it takes 48 hours for semen to evacuate the vagina. So basically, when it kind of like hit the vagina, it's like, like a big ball, like a big puff ball, like a big whatever. And then after 48 hours, once it evacuates, it kind of dulls down, but it doesn't go away. So if you always feel like I was fine, damn, I was good until we had sex, then that's kind of how you know. So it's not like who you messing with, who you this, who you that, You know, if you actually read like some articles about BV, and you know, it was interesting because when, you know, years ago, I asked one of the OGs, and an OG in medicine is like somebody who's 20 years your senior, right? And I asked the OG, I was like, well, this not making sense to me. Because women were always coming with vaginitis. So I always was kind of like, okay, how can we fix this? How can we fix this? And women would always come in. And I said to an OG, this don't make no sense to me. If you're telling me that it is not sexually transmitted, then how am I supposed to sit and tell my patient, well, it means your partner's having sex with multiple women? Well, if the partner's having sex with multiple women and he's giving you BV, wouldn't that make it sexually transmitted? And then she was like, well, technically, yes, but I said, well, if you're saying something that don't make no sense to me and I'm a doctor, how the hell am I supposed to say that to my patients, have them trust what I say and believe what I say? And of course, she didn't have any answers for me. Okay, so at the end of the day, like I said, if you can't straight up say, because then they say, well, it's not sexually transmitted, he doesn't need to be treated. Well, if he doesn't need to be treated, men don't get treated for vaginitis, dear. If he doesn't need to be, they don't have a vagina. So No, they don't have the infection. I'm not saying they're not the cause of it, but they don't actually carry the infection. But anyway, if he doesn't need to be treated, then it's not sexually transmitted. So then you kind of can't tell me. And so I thought about it a little more, and I said, well, technically, if she has a different flora, and I don't know any flora that lives on a penis after a shower. But if your man is nasty and having sex with her, not taking a shower, only wiping off his pee to eat it, and then coming home and having sex with you, I guess in some kind of way it's possible, but not so much. That's not anything you're going to base a relationship on or break a relationship up over. That's craziness. So yeah, no. Now, another big thing and if y'all have questions, like, start throwing y'all questions up there, because I usually kind of start winding down at an hour, but I want to answer y'all's questions. I really want to make sure that we on the same page as far as this trick and all that good stuff, and the cervical infection and the vaginitis, because I know it's the first time a lot of y'all are hearing about the cervical infection. Another thing I like to hit on is probiotics. Okay. It's another one of my damn pet peeves. I hate it. I hate it with the passion. Can you recommend some good probiotics? I'm glad you asked that, sis. And I'm not laughing at you. I'm laughing with you, because understand that there is a component of, what do you call this stuff? Like media and hype that is true. But it's a huge component that is just BS and it's money making. And I'm so mad. I really couldn't in good conscience do this to anybody. But I say I'm so mad that I didn't think about the probiotic thing. Baby, I'd be retired laying on somebody's beach with a whole nother identity at this point, had it been me. But here's the deal. Let me explain. Because people say, oh, it's going to return the lactobacillus to my vagina. Yeah, no, it's not. And actually, once it's gone, it's gone. Period. It is what it is. Okay? Now, probiotics. Okay, let me just go a little bit further back. The immune system. 70 to 80% of the immune system lives in your gut. I hopped on late. Did you already touch on the vaginal wash by Honey Pot, either the sensitive or the normal version? So let me just do what I'm talking about. I'll get back to that. 70% of the gut, 70% of the immune system lives in the gut, right? And so these probiotic people have come up with a 1 + 1 = 3 logic. That means that, okay, well, if 70 to 80% of the immune system is in the gut, if we strengthen the gut, then we strengthen the immune system. Yeah, no. That don't work. No. Okay. So first of all, the immune system is the immune system. If you listen to what I said, yeast is a combination of your blood sugar being high, is a combination of your carbs, your wines, your pastas, your bread, your rices. This is why diabetics suffer so much from recurrent yeast infections, because yeast is a combination, is really determined by what you put in your body. Vaginitis is environmental, is what you do to your body. Neither one of those are governed by the immune system, my dear. Now, if you say herpes, immune system. HPV, immune system. Anything viral is mediated by the immune system, not anything bacterial. And when I say that, understand, yes, immune systems fight bacteria, but it's just a whole different mechanism. Too difficult to get into, but it's a whole different mechanism. Okay. And I see your question, and I'll get back to that as far as the dove. So probiotics strengthen your gut. If you notice, how many of y'all, and raise your hand, how many of y'all have taken probiotics and then your bowels start moving, and then you start having regular bowel movements, because that's what it's designed for. It's designed to strengthen and to help your gut, not your immune system. So you can take all the probiotics in the world. How many of y'all taking vaginal probiotics? How many of y'all seen the difference? Don't worry, I'll wait. I got time. Okay. Now, somebody asked me about Honey Pot, something. I don't care what name you put in on. This is no shade. This is no tea. Like I said, B. Dixon seems like a perfectly cool person. I reached out to her, asked her a question. She was kind enough. She returned my message and, answered my question. No drama, okay? But I don't recommend any bubble bath, any body wash, any liquid soap. I don't care who made it, and that's on period. Sorry. Now, again, everybody's like, no difference at all, period. Now, somebody said, what if Dove irritates you? Now, again, if this is Dove plain white, you cannot use not the colored Dove, not the sensitive, not the exfoliating, because to be honest, I see the same results with my patients who use, because I tell people to use Dove white. They go to the grocery store and get all ambitious. I got the sensitive skin. I ain't tell you to do that. So a lot of times, if it's just the regular Dove white, let me be very clear, that I do use an herbal soap at the office. A sister by the name of Tanya Tibbs makes it. She has a V-Bar soap, which is a daily. I think you can get it on my website. If you can't get it on my website, you'll be able to get it on there by the end of the weekend. Definitely pick it up at my office, but I think you can get it on the website. But she makes an herbal soap for it's like Golden Seal and some other stuff, glycerin, some other stuff, but it's for everyday vaginal use. Then she makes an after sex soap. And then she makes a soap for the boys. She makes a soap for gay men. I don't know what's the difference and what's in what. I don't know. I just sell it. It's a proprietary formula. She ain't gonna tell me, but she hand mixes it. She pours it. She molds it. She wraps it. Like, it's a whole situation. I know my office always sells out of it. Like, I'm actually waiting for about 40 bars now. But that's what I would recommend if you can't use the Dove white. Anything else is a no-go for me. I hate to say it. It is a no-go. No, for the 40th time, no probiotics are needed, warranted, or will even work. I hate to say it. And that is that. I'm trying to make sure I got all of the comments. Check out forever. And again, I'm very funny. I want you guys to be very careful. Because people will slap organic and natural on something in a second, and you guys eat it up. You eat it up. Well, like I tell patients at my office, cocaine is organic, vegan, and natural. It don't mean it's good for you, though. So please don't be taken by, it's natural. It's natural. We'll do a talk on fibroids. That's not what we're talking about today. But it's natural. Well, everything natural ain't good for you. I hate to say it. Okay. I wish I could come to Abu Dhabi, girl. I wish I could. I don't like to fly, but I am gonna make a trip over there soon. I am. You gotta come see the new office. You would love it too. Anywho, so yeah, you just be careful. Like, my biggest thing as a gynecologist, and I'm gonna tell you, I go through the women's aisle at Target. I love it. I don't buy a damn thing on there, but I always know when it's a new product, I be like, hey, about to be paid. Office about to be packed, because y'all won't come up in there. Because you know why? And the sad part is this: all y'all want is relief. All y'all want is not to smell like tilapia. That's all y'all want. All y'all want is to be able to have sex with your man, not smell crazy afterwards, not sit down and think the wind. And y'all, when you can't smell your wind, y'all, I know people be sitting down like, I wonder if anybody smelled that. Yeah, we smell it. We smell it, sis. So, I know people just want to not be broken. And so y'all really do anything you can. So I don't fault you. I don't laugh at you, but I try and educate you in the spirit of, if you cut your leg, right? And if you cut your leg and it oozes and it starts to smell and it starts to drain, do you think it's anything at Target that can help you? That's over the counter? Okay. If you have an infection in your eye, pink eye, or any of the above, conjunctivitis, anything, whatever you want to call it, do you think it's anything over the counter that can help you? So why, with your vagina being as complex as it is, do you think that these things over the counter in Target can help you? And shout out to Target. It's my favorite damn store. Okay, it's how I get stress relief. Okay, I don't smoke. I can't really drink because, I might have to go deliver a baby. But I don't smoke. I drink very seldom. I would have had a drink tonight. But, honey, by the time this live is over, I would have been lit. So I just went on ahead and waited. But at the end of the day, and let me be very clear, if you have a problem, you have to get it treated. Okay? You have to get it treated. There's no way around it. All right. And I don't want y'all to be taken in by somebody asking me about some eucalyptus pad. Baby, I don't know nothing about that. I don't know nothing about no eucalyptus pads. I don't know nothing about that. Are you allergic to eucalyptus? What else is in this pad? Because you have to understand the lips of the skin, the vulva is still skin. If you can have an allergic reaction, you can break out. You can, be careful. Again, y'all are so, ooh, this is natural. That y'all be jacking yourselves the hell up. I tell my patients, no chlorine or raw cotton tampons. You hear me? It's going to be right next to the Playtex, the Always. It's going to be right next to that at the store. Why do I tell you to get that? Because there's no chemicals in it. People don't realize that the chemicals that are in a tampon and even a pad, it's the same chemicals that we use to clean a swimming pool. And then anything you put in your vagina is a straight shot into your bloodstream. So just my personal thoughts. I'm not saying there's any research behind it, but just my personal thoughts, baby. You got abnormal paps, can't figure out why. You got fibromyalgia. You got this, you got that. You got the third thing. Well, damn, for 30 years, 5 days a month, you putting damn chemicals, all kinds of crazy chemicals directly into your bloodstream. So I'm just saying. It's just a little something from me to y'all. Okay. So, I see it doesn't look like, anybody has any questions, anything we didn't cover, cause y'all know the roll up on me about something I took the time to teach y'all. And it's going to be some smoke. But no, if you have a question, please feel free to ask me, cause I really want y'all to be clear on this. It's like my patients know. My patients don't play any games. My patients be like, listen, doc, I know you're going to kill me. I went on vacation this weekend. I left my soap home. I had to use the body wash. I got I got the stuff. Send my script over. And I'm like, all right, no problem. As long as as long as I'm teaching you and, you all are understanding vaginitis and how it works, because I think, like I said, people are using a bunch of crap and people are able to sell y'all a bunch of crap because all people really want is relief. Okay. Somebody said, what kind of pads, tampons? Hey, girl. It is the chlorine-free or the raw cotton. You'll see them like right next to all the Tampax, Playtex, all that stuff. Right next to it, it'll say like chlorine-free or raw cotton. I really, really, really encourage those for my patients. I can't answer that as far as the chemical, the tampons triggering Bartholin cyst. Potentially, I can't answer that. I don't know what the hell they're doing because of the foolishness that they have in them. So, I don't know that we'll ever know, because again, it's a billion, maybe even $1 trillion industry, baby. Who gonna put something out on them? I'm telling you, people like the mafia. You don't want no trouble. You don't want no smoke. I'm gonna speak my truth, but it's just little old me on Instagram. But yeah, nobody's ever gonna put out any research papers to show one or the other. But like I said, to prevent all of that, I am a physician, but I do try and be as holistic and as natural as I possibly can when it makes sense. Okay, stop slathering coconut oil down on your coochie and think you're going to be fine. It ain't going to work, sir. It just not. But like I said, in situations like that, yes, use the raw cotton, use the all natural tampons. Why not? Okay. And that's a big thing for me. Honestly, I don't know the names of any. I don't know the companies. Just raw cotton is what you're looking for, or chlorine free. And that's pretty much it. That is pretty much it. A couple of other tidbits I do give my patients, since we're on here. As far as waxing, people, can you wax? Yeah, you can wax. You can wax. I have no issues with you waxing. One thing I tell my patients is, again, put a tampon in when you go for waxing. 1, it'll protect your vagina. 2, nobody needs to be exposed to your discharge. I'm not saying it's infected or anything like that, but just nobody needs to be exposed to it. That's just too... it's just too personal. Like, just put it in. Like, Will I start making pads and tampons, baby? I would love to, but let me tell you how my staff will really come after me. Like, I'm not even going to, it's so hard to find people in Atlanta to work. You know, everybody on Instagram, everybody, the CEO of some unknown company, and nobody actually wants to come to work. So we be working double and triple duty at my office. So I'm going to tell you, I would love to embark on some new things, but I promise my staff that for all of 2021, and God willing, we all see 21 and 22, that I'm not embarking on any new journeys because everybody's exhausted and overworked. So no, I'm not going to. I don't have any plans to immediately. But you never know with me. You never know. But anyway, so I was saying, y'all, about the pads and the waxing. Please, please, please. I just feel like it's just more sanitary. And you can always let your waxing person know, hey, listen, I'm not on my period. I just, it's just a protective mechanism to protect my vagina. And so that you don't have to be exposed to anything, you don't want to be exposed to. They'll respect you for that. Also, make sure you go to a wax place that uses hard wax. Apparently for African American skin, my patients told me this. She owns a waxing salon. But for African American skin, hard wax is better, and it's better for ingrowns, okay? So that part. And then also when you wax, please, 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 guys, wax early in the day. It sounds ridiculous, but wax early in the day, okay? Love you too, girlie. Stay safe, and I can't wait to come home again. And the reason for that is this. They turn the wax on in the morning. They leave it on all day. And then here you go at 4 o'clock in the evening, 5 o'clock in the evening when you get off of work. And that wax been on all day. Baby, it got to be about 200 degrees at that point. I would say, obviously they're not going to do this, but it would be dope if at, noon, they would shut the wax off for 2 hours, allow it to cool down, and then, get it back together again. But they usually don't. So I tell my patients, go in the beginning of the day, because everybody's like, oh yeah, the skin. Yeah, I did know what you had was a 2nd degree burn. That wasn't a rip. That was a whole 2nd degree burn. And then they rip the wax off after they burned your skin. They just rip that, and they didn't mean any harm, but like I said, it is what it is. I said, educate yourself and get waxed earlier in the day. I just think I just think it's safer. If you're able to afford it, because people think that waxing is the best option. I transitioned a long time ago into laser hair removal. If you're able to do it, it's less painful. I feel like it's less painful. And the results are longer lasting. So somebody asked me about period panties. Baby, you must just not know me at all. You must not understand clean and cute. I don't really know, but we don't believe in period panties over here. At the end of the day, figure out what your menstrual needs are. Panties are $5. So if you leak on a pair of panties, especially if you're not washing them with clean and cute panty wash, don't keep recycling those same panties with blood in them that your Tide or whatever it is you use, your Gain or whatever, is not actually getting out, and then you continue to use them. That is not the business, okay? So yeah. I don't know what free bleeding is. Does that mean the cup, or does that mean you don't wear anything and you just bleed in all your clothes? I wouldn't assume that that's what it is. I'm going to assume, and kind of jump in here, sis, and let me know what free bleeding actually is. Somebody said, what do you think about free bleeding? I'm not exactly sure what that is, but, as far as the cap is, the what do you call this thing? The vaginal cup. I ain't got no problems with the cup. I don't understand it, but I don't have any problems with it. Way back in the day when it first came out, it's been out for a long time. It's just, yes, it is. I actually just shipped yours today. And for anybody else, I'm sorry, we just shipped off 200 orders today. Haven't gotten a chance to put all the tracking numbers in, but y'all will be getting your tracking numbers later on this evening. But anyway, that cup, how you get it from twisting? I tried to use it. Maybe it was just back in the day, maybe I was just, too young, and I don't know, but my cup twisted. It wasn't cute. I was like, this ain't really for me. This is not my ministry. And that is pretty much it. Yes, Miss Nanny Brady Angel, we just moved to a new office, a new location. So our web person pulled down our page earlier this week to make some adjustments and all that good stuff. So it'll be back up, I guess, next week. But yeah, we pulled it down so we could revamp it and go from there. Okay, yoni steams. And I'm going to take like 2-3 more questions, y'all. So get them in there with the quickness. Yoni steams. First of all, I don't really like that word yoni, but okay. But anyway, so first of all, about the vag steam. I'm here for a good vag steam. Yes, 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 yes. I'm here for a good vag steam. It's all about yes, but. Okay, and here we go with the but. Y'all don't be knowing what people are steaming. Like, I do vag steams in my office. I'm not trying to sell them to anybody. I'm just saying I do them in my office, but it took a lot of research and learning. If anybody's in Atlanta, I went to Jeju. Jeju's like the mecca for the vag steaming. I was like, can I screenshot this? So they had 19 herbs on their thing. I went, I've read, I learned about all of them. And then in all my reading, I found 4 more that were specific to women's health. I ordered them all from China because they're Chinese herbs. And it took like 3-4 weeks to get here. And so we actually have the raw herb that when we make a steam, we literally make it by hand. And then like halfway, like 40 minutes through, because the steam lasts about an hour. So about 40 minutes through our steam, we sprinkle some stuff on it and make your coochie tight and wet. Like it's everything. I'm so busy. I barely ever get a chance to do it, but it definitely is the truth. Okay. But y'all are buying these little packs. I actually called the place for one of my patients. She's like, oh, I'm going to get the steam. I said, let me talk to the people. So I called them. I said, hi, I'm thinking about coming to get a vag steam. Can you tell me what herbs you're saying? Well, I don't know. What? I don't know. I said, what does that mean? You don't know? She's like, well, they come pre-made in a pack. So y'all don't know what y'all doing. Like, y'all don't know what. See, here's the deal. This stuff works. This is another thing I've been telling you. People think herbal is good. Well, medicine comes from herbs. So if you take the wrong medicine, you're going to be jacked up, right? Okay, well, it's the same as with the herbs. Y'all got people steaming damn rosemary and thyme and some salt like y'all coochie is a damn lamb chop. And then y'all expecting all the. You got to know what you're steaming because you can do yourself as much harm as you can good. So please know and understand, I'm all for a good steam. It's Eastern medicine. I'm all about some good Eastern medicine. Please believe me, but you have to be informed about that just like you have to do anything else. And I really don't like the at home, because basically you're sitting on a sitz bath. In order for you to truly get the steam, you have to wear we have you wear like this plastic, it's hot as hell, but this plastic gown in the office that drapes over the pot that's actually steaming so that you don't let any of the steam out. It's a steam. Y'all are sitting on sitz baths at the house. That ain't working. That's like the Section 8 version. Shout out to people with Section 8. But that's the Section 8 version of an actual vag steam. And then you steaming the stuff that's in the damn pantry, not actual real herbs that are going to do your vagina some good. So just be very careful about that. No, I didn't touch on boric acid. I would never touch on boric acid. I'm about to come at your neck virtually about this boric acid. Let me tell you something. Why would you put something that kills roaches, rodents, and anything else in your coochie? Is it that bad, sir? You have got to get treated. I said it again. If you got an infection, baby, you got to fix that infection. And that's on period. Don't feel like you're failing all the treatment. Maybe, just maybe, you're not being treated for the right thing with the right thing. Okay? So yeah, boric acid is a no for me. It's a no for me. And I get that some gynecologists get so frustrated that they just be like, here go your year's supply of vaginitis. Of metronidazole. That's not how you handle that. Here, when you failed everything else, go ahead and take this boric acid. That's not how you handle that. When you have things that are kind of like ridiculous, be careful that these people are not selling this to you. Now, the people who got y'all on this boric acid, they selling them, ain't they? The people who got y'all on these vaginal probiotics that don't exist, they selling them, ain't they? I know. So be careful what you will allow people to sell you and what you buy. The vagina is very simple, okay? The thing is that you have to be mindful. You have to be respectful of what you do to the vagina. You have to be respectful of what you expose the vagina to. You have to be respectful of how you treat and clean your vagina, and then it will be good to you. It's no mystery. It's no whole bunch of this. It's no special formula. It's no whole bunch of everything that you got to do to get your vagina back on track, okay? But you have to do what is necessary to be done. Okay, does that make any sense? Like I said, we be going too far, we be doing too much, and then we just can't understand when a vagina won't act right. And I don't, back in the day, they used to use boric acid for, I guess, yeast, and I thought it was ridiculous then. But I was a kid, I didn't know any medicine. Now that I know some medicine, I think it's even more ridiculous. But again, it's on a comeback. I don't know why. I guess doctors are getting frustrated, women are getting frustrated, but again, if y'all follow the blueprint, even if you're not in Atlanta, if you follow the blueprint, okay, you will be okay. All right. And I'm going to do a bunch of these all over again because I know it's the one thing that plagues women. It really, really is. It plagues women. But if you follow the blueprint, you'll be all right. Okay, so don't get frustrated. Don't overtreat your vagina. If you have a vaginitis, trust me, if you have an odor of any kind, you have an infection, period. If there's an odor, there's an infection. If you have a vaginitis, please get it treated and then change your habits. If you don't believe my blueprint, keep doing exactly what you're doing and you will continue to get vaginitis. Okay? All right, y'all. So it is a little after 8. I got to go. Yeah, and thank y'all for joining me. I appreciate it. Don't know when I'm going to do another one, probably in the next week and a half, maybe 2 weeks. But whenever I do it, I try to make sure I always talk about something that y'all want to talk about. I know people are deep into this fibroid thing, but if you will, drop a line either in my inbox or on Clean & Q or wherever to let me know kind of like what you guys want to know and understand and what you feel like maybe your provider's not talking to you about. And I love this networking because somebody on here dropped the line of a Black female gynecologist in Charlotte. I used to live in Greensboro and I would travel to Charlotte for my gynecologist, but I don't remember what her name was. But anyway, so, and if you have a good, I don't sign off on anybody just because they Black. They got to be Black and good. Okay. And so I know listen, Black and good. And that and is a capital A-N-D. I don't just send my folks anywhere. So I'm not going to sign off on her because I don't know her. But again, I think this is great networking. And so if you guys do know her or did get the name, look her up. Look at her reviews, go and visit her if you're in the area and see what you think. So I'm going to sign off now, but everybody have a great weekend. And again, let me know what y'all want to talk about because I want to talk about not what I want to talk about, but I want to talk about what y'all want to hear. Okay, so I'm out. I'm going to start my weekend and I will see y'all. And if you're be looking for your tracking numbers. If you order Clean & Cute, look in your spam folder before you call us and say you didn't get a tracking number. Some of y'all might because we didn't get all the orders out. We waiting on supplies. Why are we waiting on supplies? Because the whole damn country was frozen. But now we got all of our stuff and we working like crap. The distribution team, they still there. I had to go because I had to come home, take a shower and, get comfortable before I, got online. But thank you so much. I love y'all to pieces. But the distribution team is still there trying to get y'all stuff out. So be patient with us. We're getting this stuff out and I'm going to get these tracking numbers in this evening. So everybody have a great weekend and thank you for tuning in. I love y'all.